Understanding colorectal cancer. Causes, signs, symptoms, and treatment. Colorectal cancer is a type of cancer that starts in the colon or rectum, parts of the large intestine. It often begins as non-cancerous polyps that can develop into cancer over time. This video provides an overview of the causes, signs, symptoms, and treatment options for colorectal cancer. Causes of colorectal cancer. 1. Genetic factors. Family history. Having a close relative with colorectal cancer increases risk. Inherited conditions. Genetic syndromes like Lynch syndrome, HNPCC, and familial adenomatous polyposis, FAP, are associated with higher risk. 2. Lifestyle factors. Diet. High intake of red and processed meats, low fiber, and low fruit and vegetable consumption. Physical inactivity. Sedentary lifestyle increases risk. Obesity. Higher body fat, particularly abdominal fat, is linked to increased risk. Smoking. Long-term smokers have a higher risk of developing colorectal cancer. Alcohol consumption. Heavy alcohol use is associated with higher risk. 3. Medical conditions. Chronic inflammatory bowel diseases. Conditions like ulcerative colitis and Crohn's disease increase risk. Type 2 diabetes. Increased risk associated with insulin resistance and chronic inflammation. 4. Age. Risk increases significantly after the age of 50. 5. Previous colorectal cancer or polyps. Individuals with a history of colorectal polyps or cancer are at increased risk. Signs and symptoms. 1. Changes in bowel habits. Diarrhea or constipation. Persistent changes in bowel habits lasting more than a few days. Narrow stools. Stools that are narrower than usual. 2. Rectal bleeding. Blood in stool. Presence of bright red or dark blood in the stool. Rectal bleeding. Blood seen on toilet paper or in the toilet bowl. 3. Abdominal discomfort. Cramps or pain. Frequent gas pains, bloating, fullness, or cramping. Unexplained pain. Persistent or severe abdominal pain that does not go away. Unintended weight loss. Significant weight loss. Losing weight without changes in diet or exercise. 4. Weakness and fatigue. Anemia. Chronic blood loss can lead to iron deficiency anemia, causing fatigue and weakness. 5. Incomplete bowel emptying. Feeling of fullness. Feeling that the bowel does not empty completely after a bowel movement. Treatment. 1. Surgery. Polypectomy. Removal of polyps during a colonoscopy if detected early. Colectomy. Partial or total removal of the colon if cancer has spread beyond the polyps. Laparoscopic surgery. Minimally invasive surgery for smaller tumors. Colostomy. Creating an opening in the abdominal wall to divert waste in some cases. 2. Radiation therapy. External beam radiation. Used to target and kill cancer cells, often before or after surgery. Internal radiation. Brachytherapy. Placement of radioactive material inside or near the tumor. 3. Chemotherapy. Adjuvant chemotherapy. Used after surgery to destroy remaining cancer cells. Neoadjuvant chemotherapy. Used before surgery to shrink tumors. Systemic chemotherapy. Uses drugs that travel through the bloodstream to reach cancer cells throughout the body. 4. Targeted therapy. Monoclonal antibodies. Drugs like bevacizumab and cetuximab target specific proteins on cancer cells to block their growth. Tyrosine kinase inhibitors. Drugs like regorafenib that block enzymes promoting cancer cell growth. 5. Immunotherapy. Checkpoint inhibitors. Drugs that help the immune system recognize and attack cancer cells, such as pembrolizumab. 6. Lifestyle and supportive care. Diet and nutrition. Healthy eating to support overall health and recovery. Physical activity. Regular exercise to improve physical function and reduce fatigue. Palliative care. Supportive care to manage symptoms and improve quality of life for advanced cancer.